So today what I want to talk to you about is our skin. So there's a common misconception with, let's say, body contouring procedures, tummy tucks, breast uplifts, facelifts, that the skin needs to be pulled tight. So there is no time in our life that our skin is tight. When we're babies, as we grow, the skin is never tight, but it has very good elasticity. That is what's changing as we age. The skin loosens. Another very important principle is that skins that are pulled tight are stimulated to stretch. So for instance, when someone is having a breast implant, or let's say a breast reconstruction with a tissue expander, a expander or an implant is placed inside under the skin, and it's placing tension and stretching the skin. And we know from this that it takes about 3 months for the skin to stretch, and then it begins to relax. So when we pull something tight with a surgery, so for instance a tummy tuck, or a breast uplift that's tightening and lifting the breast, or a facelift that's pulling somewhat, that skin with that tension is stimulated to stretch to its resting tension. So it's not going to stretch and fall right away, but it will stretch to a certain point over, let's say, the first 6 months, and there it will stay. And then as you age, it begins to slowly elongate again. So when patients ask, well, how long does a facelift last? Or let's say they do a tummy tuck and it's initially tight, and 6 months later or so, they're able to pinch a little skin. That's completely normal. Or with the facelift, it's lifted, it looks good, and within 6 months, you get a little recurrence here. That's normal. That doesn't mean the procedure wasn't done properly. That's the skin's natural response to stretching. So when we're doing these procedures, we know how to do them. We know what gives a good result and what goes into a good procedure. But there is some recurrence or relapse of the preoperative appearance. But the average procedure is going to give you actually a lifelong change. You'll never look like you did. But procedures can be redone. They do need to be touched up sometimes, or performed all over again, but several years after the original.